I truly believe that to be effective, you have to be able to, even if you can't walk a mile in your patient's shoes, you need to at least try them on. My family is actually from Mississippi. I was born in Tennessee, but my parents moved north. They were witness to initial parts of the civil rights movement and wanted us raised in a more kind of open-minded area. So we ended up in the Northeast, and then I went to undergrad at Berkeley. And I would say that was where I really kind of came into my own kind of political thinking, but professionally, I didn't know what I was going to do. I was an anthro major and peace and conflict studies major, and had a goal of working in nonprofits. and then after I did that for a few years, I felt a little not empowered enough as a professional, and thought about what could I do, what kind of education could I get that would give me more power behind advocacy. My parents really raised us to be conscious of that, of disparities. And when we would come visit our relatives in Mississippi, my parents did things like dropped us off. They came in with us, but took us to I think it was a Kmart in a neighborhood that was not my grandparents' neighborhood, and wanted us to see what it felt like to be the only white person in a store. I had originally planned on being a community clinic physician in Northern California, which is where I trained. But over time there, I realized we were inundated with people just like me who had the same politics and the same mindset and the same mission and the same goal. And I felt like I was kind of getting bored of that and wanted more of a challenge. And right around the time that we were talking about if we left, where would we go, there was a series of articles in the New York Times about Georgia, and they were about the Spanish-speaking immigrant population, which is one of my beloved populations from working in Northern California. And the series of articles talked about the racism that they were facing. And then there was a separate article on talking about a lack of primary care providers in general in Georgia and in the Southeast, and specifically that there weren't very many providers that were trained in dealing with immigrant populations. There weren't very many bilingual providers. So I thought, wow, this would be, I might actually be useful there. So I see a ton of Medicaid and uninsured and Spanish-speaking patients, which is really who I want to see. And my heart is as a community physician, not as a private practice doctor. In my mind, I've always felt like that to be a community physician in a true kind of public, underserved population-based clinic, that it is a setup for burnout, and that one of the ways to avoid that is to have kind of a mixed practice, which is to say partially teaching, which I think is good for the patients, it's good for the students, then it's good for you as a physician because it helps you stay up to date and it helps you stay inspired. Being a teacher is great. It forces you to find the vocabulary and verbalize what it is that you do with your patients every day. And also having the students in my office is really fun, and getting them exposed to my type of patients and the relationships I have with them, and all of that. It's a great opportunity to hopefully motivate someone towards primary care. And hopefully down the road, we'll have a big community practice, is my dream, in Athens, where we'll really have coordinated care, and the teaching and the patient care is all part of the spectrum and a continuum of education and service.